Hi, good morning. It's Dr. Ben. It's a little bit of a gray day out here on the back porch. Two of what, as a non bird person, I can only guess might be swallows based on their tails. We're just flapping around the backyard. Yeah, it looks like it's going to be a pretty nice day. So, let's go into questions and then we'll do updates after that. First question is from Courtney. Good morning, Courtney. I'd like to know more about the antibody test. I'm a healthcare worker in a long term care facility. I would like to know the benefits or pro and con of getting the test. Thank you. Yeah, okay. Interesting. Yeah. So, long term care facilities have been, as you totally know, but just for everybody else, these have been a real hotbed for infection just because if one person gets infected there, everybody else is quite vulnerable, and this can lead to very large sort of pockets of outbreaks. We've seen big ones in several states now. The first one I had heard about was up in Washington State, and also in other countries. So, the benefit to the antibody test, I don't know. The antibody test would tell you if at some point in the past you've had the SARS coronavirus 2 infection. But that's not really particularly useful because, by the time you would test positive, you could have infected everybody else that's in that long-term care facility, or at least very nearly. And so, yeah, it's kind of not particularly valuable in tracking down like an ongoing outbreak. As a thing, if somebody is offering this test and you can just take it, they'll give you the peace of mind to at least know whether you have been infected in the past or not. Yeah, which may make you sleep better at night. And the information is useful to epidemiologists. They'll like having one more tick in the infected or not infected column. But yeah, not a ton of use as far as protecting the people that you would be taking care of right now, I think. So, yeah, unless this is part of some sort of program where they're doing surveillance, for example, some places are actively going out and trying to do antibody tests in settings like care homes where they know there are lots of people that can be sampled just to try and get a sense of how big this was and if the infection might have blown through without anybody really realizing. Yeah, which seems unlikely, but could happen. Yeah, there's enough asymptomatic cases out there that it could happen. And so, yeah, if you're part of one of those studies, then yeah, by all means, shoot. Yeah, I've been a data point in some studies in my time, and yeah, I would say you can too. But other than that, if it's just for you, then yeah, if you think that's something that knowledge would help you have a better life, then go for it. But not particularly useful in tracking the ongoing outbreak. But as we go forward, they might want to start doing nasal swab testing, which is like annoying and painful from what I've heard. They're trying to get at the cells that are right up on the top of the nose, and they're fairly far back, and so that ends up being a pretty uncomfortable swabbing. But that is a good way to actually detect live virus, at least fairly early, much earlier than the antibody test in the infection. So, yeah, that might be a thing to consider in the future. So there we go. That's the answer as far as I can give it anyway. Thanks very much. This is Ask Dr. Ben.